So in T-cell acute lymphoblastic leukemia, one of the major mutations, up to about 60% of all patients, have activating mutations in Notch. And so what we're trying to do in some of the precision medicine programs is to prevent Notch signaling, and this has historically been done by designing gamma-secretase inhibitors. Why gamma-secretase? Because that is the enzyme which cleaves and releases the intracellular portion of Notch to drive the cell proliferation of the disease. And so we want to stop that, and that's why these drugs have been historically designed. So one of the big problems with gamma-secretase inhibitors and why they've really failed in the clinic is that they're very broad spectrum. So they classically have on-target toxicity. And so this means that we not only target Notch, well, mutant Notch in the T-cell leukemia, but also the wild-type Notch in the gut and the normal T-cells. And so what we're trying to do is make a better drug which selectively only targets the gamma-secretase complex in T-cell leukemia cells. And this has been very challenging, and all the gamma-secretase inhibitors to date have failed because they are attacking all the different types of gamma-secretase complexes, of which there are actually more than one. There's four, and the distinguishing feature is presilin 1 and presilin 2, which is the enzymatic complex, enzymatic protein within that complex. So this study was really a chance finding, and what we found was when we talked to some Alzheimer's researchers who are also trying to prevent ectopic Notch signaling, is they kind of told us, well, gamma-secretase complex is not just one, it's actually four different types. At least four different types, and that's the inclusion basically in two broad categories with presilin 1 and presilin 2. And so we kind of asked the question, well, which of these complexes are being expressed in T-cell leukemia? And to our surprise, it was just one complex, those which have presilin 1. So there's no presilin 2 complexes at all expressed. And so what we found is that if you genetically remove that, you can prevent Notch-induced leukemia. And moreover, there's a drug, Merck 560, which is a presilin 1 selective inhibitor. And what happens in our study is that if you treat leukemia cells, you kill the cells, but the most surprising finding was that it has absolutely no toxicity in the gut, which has been the primary reason why these have stopped in the clinic. And the reason that we found is that in the gut you have equal levels of presilin 1 and presilin 2 complexes, so you get compensation. You get death in leukemia because there's only one complex, but in the gut you have multiple, and actually most healthy tissues have multiple copies of these gamma-secretase complexes, and because we can selectively target just one, we can have excellent efficacy and toxicity in the leukemia cells, but none in an otherwise healthy tissue, and that's the great big study finding. So one of the big challenges now is to try and resurrect this kind of field in terms of gamma-secretase inhibition and try and educate people to say, right, well, the reason why gamma-secretase inhibitors have failed in the past is because we didn't really understand that there were multiple types of gamma-secretase complexes. And the broad spectrum inhibitors of the past have failed because they've been broad spectrum. So the challenge now is to say, look, we can get these drugs like Merck 560, which selectively target T-cell leukemia, to get that into clinical trial and actually get them out of our hands and into the patients which really require this drug. And of course, Merck 560 is the kind of the first generation, and now what's happening is we're trying to do some chemistry to try and make it even more selective for presilin 1 and then get that into patients as quickly as possible.